And I think that also with the lip, I do that sometimes. If somebody's like, listen, you know, I'm not ready for filler. I've never had it before. I'm nervous. I don't know if it's gonna look too fake, you know? I say, let's just do a little lip flip. Let's just do a little neurotoxin right on top and get that projection a little bit so that when they see that, they're like, oh, I love that. Okay, well now I can do filler.
In this Backstage Pass series, we have authentic conversations about the evolving role that aesthetic procedures play in your life. We also dive into the often overlooked steps that you should understand before making the leap to your renewed self. These are the conversations that you want to hear, but just don't have access to until now.
So Case, I wanted to actually ask you the other day, how do you think that lip flip worked on you?
It did great, actually. It was a little interesting at first because I've never had injections in that area. Right. So it felt a little funny at first, but I love the results. It looks great, yeah.
I like it too because I find that, you know, like with filler, you can get a little bit of projection, but then when you want a little bit more of that pink pop to show, you know, a little bit more of that Cupid's bow.
Yeah, and
I
that's
find
what
that
I did.
the Dysport,
Because you did the filler first, and then we came back, and I was like, I could still want a little, it looks great. Yeah, I love it.
I'm really happy with it too. Yeah, when you smile, it looks really even.
It's interesting, and you know, people think you get, you know, Botox or Dysport or whatever it is, just, you know, just for your frown lines or your crow's feet. But I mean, there's a lot of different things that you can use it for that a lot of people don't think of.
Yeah, absolutely.
You know, one that I enjoy doing, I know you like it too, are the bunny lines, those little, you know, spots on your nose there. So.
Yeah. Because you don't really realize it, you know? And some people, when they talk, they get those like little scrunched, and it's like, well, is there anything that can fix that? And yeah, there totally is. We can definitely fix that for you, you know? Yeah. I just find that it just makes my makeup go on a little bit smoother too. Absolutely. And that's really important for us girls, so we need that
for sure.
to be contoured correctly.
What else, what other areas do you use it for that, you know, a lot of people don't know about?
Yeah, well, we can definitely raise that brow arch too, which is really nice because a lot of people, when they come in, especially even if they feel, I want to do my forehead, but some people do get that a little bit of a heaviness to their brows. I say, well, we can do a little bit of a brow lift on you too, you know, just to kind of complement that a little bit, give you a little bit more of an arch. So yeah, so your makeup can go on nicer. And it's actually even for men too. I've had men come in and they want a little bit more of an arch too. For sure. It's for everybody. Yeah, definitely.
People who come in because they don't like their neck. It's the platysma bands that you get, those little, you know, lines that go up and down. And
because that could really pull on that so much and just cause a lot of aging.
And it shows in pictures.
Oh yeah, it shows a lot in pictures. And they'll get really used to that and they'll be like, wait, I want that, you know, forever, basically. For sure. And then we'll say, well, then you gotta, you know, probably do that surgical route. But it's a great like introduction, I find too. And I think that also with the lip, I do that sometimes. If somebody's like, listen, you know, I'm not ready for filler. I've never had it before. I'm nervous. I don't know if it's gonna look too fake, you know? I say, let's just do a little lip flip. Let's just do a little neurotoxin right on top and get that projection a little bit so that when they see that, they're like, oh, I love that. Okay, well now I can do filler.
Well, even my experience, I had a patient after that who was terrified of fillers.
Oh, I remember.
And so I told her,
you were saying.
well, just do the lip flip. She did that and I think you did it on her. So it's a great way to ease them into the fillers and whatnot.